the Commissioner and his team are here to give us the right answer to all our questions. So we'll be taking it in verses, and that we are going to take the first set. We are going to have 5 correspondents that will be asking questions. After taking the first 5, we'll go and sit down and we'll take the second again. And that is how we'll be taking it so that everything can be orderly. So, the Honorable Commissioner, distinguished ladies and gentlemen, we'll start with question answering. Yeah, can you please come forward?
Good evening, Honorable Commissioner and distinguished members of the Ministry of Health. I'm Mary Alale Yusuf from Channels Television. The cases in Lagos today in 3 digits, almost 200 cases. It's rising so fast. Lagos is a densely populated area, yes, but Kano is also densely populated. What is informing Lagos, the rise in Lagos? Is it testing, or is there something they are not doing in Kano? Could we get some more light on why Lagos is having so many cases every day? Then, what is the situation with bed spaces now? Currently, active cases in Lagos, I think it's at 2,233 active cases, something in the neighborhood of that. What is the condition of accommodation for the patients? Then I want to know if you are standing by your model of 120,000, 90 to 120,000 cases by July. And if it is so, what plans are in place to tackle this number? And finally, this morning, the DG of NCDC spoke about a new protocol of just 1 negative test before discharging patients. Now, my question is, does this pose a danger to the public when the patient has come out of isolation? What is the impact? Thank you.
Good afternoon, sir. My name is Amina Telegishi, health correspondent for Lagos Television. My first question is, do we have any update from the Herbal Medicine Board from your last briefing? We are expecting update from them. And is the State Ministry also looking into proposals from in-house researchers? A few days back, we spoke to the CMD of LASUTH, and he said the in-house researchers committee of the institution came up with some proposals that they are still pushing forward. So is the ministry looking at these proposals? Are we expecting any solution coming from the in-house researchers in the state? Lastly, I also want to ask about the last time you said something about this, but want a better clarification. Is there any disadvantage? Are there disadvantages of wearing face masks? You know, we've been seeing videos of some people saying, okay, people are collapsing from wearing it and all of that. What medical disadvantage, I think, let me put it that way, medical disadvantages of wearing it? And also, what is the state ministry doing to collaborate with security agencies towards proper education about this? I remember last week a police officer stopped me. I was the only one in the car, and he said I'm not wearing a face mask. So what are we doing to ensure this education is going, especially they are law enforcers. They need to understand what they are, what part of the law they are enforcing. Thank you.
Good afternoon, Prof. My name is Tokumbo Yetunji. I report for Arise TV. You once told us during one of your briefings that the fight against COVID-19 in Lagos will record more success with a proper buy-in from the communities. as of today, would you say the buy-in that you're expecting from the communities in Lagos, you've achieved it? Number two, the UAE returnees, I think today makes about 16 days that they returned. What's the update? Are they still there? Have they been discharged? What do you want to tell us about them? Finally, sir, you told us about the clinical trials for hydroxychloroquine starting the next week after you briefed us. What is the new thing that you want to tell us about that situation? And the participation of Lagos State in the WHO coordinated international solidarity trial. Thank you.
Good afternoon, everybody. Good afternoon, sir. Sir, my name is Oshomo Wadanes. I report for AIT. There is an emerging trend that I've heard from doctors also. They call it COVID-19 phobia. That some healthcare workers tactically avoid patients. Even when they present with other ailments, maybe like malaria and all this, they don't bother to check them. And this is making more people die from other diseases other than COVID-19 because they don't want to get infected with the virus. And then secondly, it's more of an apology. I see you on other medium from time to time, and I've been calling, sending messages. I want to have you on AIT. You never obliged, sir. I don't know if there's anything we've done that you don't like, and I apologize on behalf of my management. Thank you, sir.
Good afternoon, Prof. My name is Akeyemi Emmanuel. I report for ECO Online. Prof, please, sir, we have this report coming from PAC in the state, especially those in Bariga, LCDA. We have the report that they are turning babies down for immunization, including newborns, owing to COVID-19. We want your reaction to this, sir. The second question is, with the emergence of this COVID-19, sir, people in Lagos especially, they have lost social and economic, they are in so many ways unquantifiable. I don't know how much the state is doing. What information of hope, message of hope are you passing? On a daily basis, we are hearing people committing suicide as a result of their economic and social losses that they can't even fathom now. So, daily reports, we are having it too many. So, what message of hope is Lagos State, in particular, Ministry of Health, passing to people across the state, just to glean on to something? Hope. Hope. How much hope are you passing on to them so that they can restore their hope that they have lost with the attendance of this COVID-19? Thank you, sir.
Honorable Commissioner, sir.
Thank you very much, distinguished members of the press, my colleagues, permanent secretaries, special advisor to the governor on health. We thought we would make today an interactive day so that I know you have a lot of questions, and it's obvious from the barrage of questions that you've asked in the first round. We said we want 5 questions. You've asked almost 16. But that's okay. We will take your questions. It's obvious that the people of the press and the people of Lagos want answers to certain questions, and we're very happy to produce them as we understand and as we know them. So the first question was around the increasing numbers of cases in Lagos, and that seemed to be that question was presented as a comparison with Kano. Since Lagos and Kano have a similar demographic, why are we seeing so many cases in Lagos as compared to Kano? Well, the way you described the question was that there is a dramatic increase. So it's not a dramatic increase, it's a gradual increase. When you would say something is dramatic is if it goes from 50 to 200 to 1,000. That would be dramatic. And that's what was seen in the northern hemispheres, in Europe and America. There was dramatic increase in numbers. Ours is gradual. We've gone from 50 to 70 to 100 to 130 to 150, and now for the first time we're seeing numbers approaching 200 per day. So that is a factor of several things. The first factor is that we know the disease, the outbreak is expanding. So we expect to see more cases. We have not reached our peak yet, but the graph and the rate of increase of new cases is very gentle. And that is what we defined by our model, and it is following true to the trend that we defined in our model to see this kind of increase. So we know that we were going to see about 200 by this time. Maybe by next week, we might be seeing 250 or 300 per day. The other factor is that we have increased our testing capacity in the laboratories. We now have 4 laboratories that are testing, and they're testing, they have the capacity to test 24 hours a day on different shifts. So our total testing capacity has gone up to almost 800 tests a day. And with some new equipment that we are fitting into our testing laboratories, we should be able to exceed 100 tests per day soon. So the more you test, the more cases you will find. Thirdly, we've decentralized our sample collection. So we're collecting samples in 20 local governments now. So if you want to get tested, you don't have to find your way to one of our isolation facilities, or you don't have to wait for our epidemiology team to come to your house. You can easily walk or find your way to one of those 20 decentralized sample collection sites. And as a result of that, we're seeing more people coming forward for testing. Now, when you compare us to Kano, Kano only has 1 laboratory for testing, as far as I know. And in fact, that laboratory has only just become operational. And from our experience, even when we operationalize a laboratory, it still takes a week or 2 of teething problems before you get the tests running smoothly. So there is no way that Kano can be testing as much as Lagos. And Lagos has had 4 established laboratories running now for almost up to 2 months. They're well experienced, they're seasoned, they're working on 3 shifts a day. So our testing capacity is much higher than Kano, and therefore our rate of diagnosis has got to be much higher than in Kano. I can't say what the disease profile is in Kano, but for us, based on our testing capacity, we're seeing more cases, and that's the idea. We want to identify as many people as possible, particularly those that are sick and need help. We need to identify them quickly. The question around bed space. You would imagine that as we diagnose more cases, that our bed capacity will increase. Indeed, that's happening. As we open new isolation facilities, they start to fill up relatively quickly. And we're running at about between 60 and 70% bed occupancy now across about 5 or 6 isolation and holding centers. Now remember, as we admit, we're also discharging. So it's not it's not like a black hole where patients just go in and don't come out. So as we admit, we're discharging. And also, one of the reasons why we're not you would expect us to be full by now based on the number of cases we're diagnosing. The only reason why we're not full is two reasons. As we admit, we discharge. That's one reason. But as we diagnose and we try to evacuate the patients to the isolation centers, we're finding it difficult finding some patients. And the trend is increasing. So it seems as if people who get a positive test are reluctant to be admitted, maybe because of the stigma, which we are working very hard on, because there shouldn't really be a stigma around COVID. COVID is just like any other infection. When you catch malaria, it's not a stigmatizing disease. When you catch a cold, it's not a stigmatizing disease. When you catch the flu, it's not stigmatization. So we're wondering why COVID is associated with such stigma, and we're working hard to understand these reasons, and so that we can give psychosocial counseling to the general populace of Lagos, that COVID is just like any other disease, and we should refrain from stigmatizing those people that have COVID. So, the point I'm making is that there are people who are already practicing self-home isolation on their own. Because we can't find them, the numbers they give us, maybe they are false numbers or they don't answer their phones. When we go and retrieve them in their residences, they have absconded from their residences. So they are isolating themselves in different places. So, in effect, the concept of home isolation is being practiced by many Nigerians, even though it is not yet a state or a national policy. But the people of Lagos are practicing home isolation, which is one of the reasons why we as government are trying to transition to home care, home-based, because it's happening anyway. So we might as well regularize it and make it an official option for some people, especially if you're mild or asymptomatic, to isolate yourself at home. So we're spending a lot of time working around the parameters of what home isolation is going to look like. In another week or so, we'll be able to give you the definitive parameters of how the state is going to integrate home-based care into our isolation strategies. You asked around the model of between 90 and 120,000 by the end of July. According to our model, that is still standing, and the number of new cases we see per day justifies that model. Remember, this is a cumulative number. So if we're seeing 200 per day today, and by next week we're seeing, if you do the maths anyway without modeling, it will add up to that number cumulatively. So even those that have been treated and discharged, they're still part of that 90,000. And the model is suggesting that we are on target for 90,000 new total cases by the end of July. It doesn't mean that there's going to be a sudden spike. It's in keeping with our gradual increase in the numbers of cases, and we hope that as more people will have caught COVID-19 and recovered, those people have developed immunity, and you've heard of the concept of herd immunity. Herd immunity just means that the number of people in society who have caught COVID and recovered are not likely to be able to catch it again. And so the virus will then start to run out of its opportunity to be infective, and eventually we will reach the peak, and then we will start going down, and that will signify the end of the outbreak. However, you've seen that in other countries around the world, you've heard about the first wave and the second wave and the third wave. The virus could come back And what it will be doing is it will be looking for members of the community that it hasn't infected before. And so you may get a second wave. The waves are usually smaller than the preceding wave. So the first wave is usually the largest wave. Then the second wave can be smaller, and the third wave will even be smaller. As the herd immunity increases, the number of people that it can infect decreases, and so the second and the third wave reduces in amplitude over time. So as we've seen in China, there's a new outbreak going on in China, in a different province, because the Wuhan province probably has a very high level of herd immunity. So the virus has gone to look for another community in China where it has started a new second wave of outbreak in that country. The practice of using one negative test to discharge patients is something that we accept and we adopt because I've just told you that we are beginning to accept the concept of home-based care. So by the time you get one negative, there is a chance that a day or two later you may become positive again because the virus has managed to escape your immune system and start secreting itself in very small quantities. And then maybe a week later you will clear it finally. So if we're practicing home-based care, and there are many people who are already doing home-based care, what we're saying is that by the time you clear your virus for the first time, you are about to clear it either permanently at that point or soon after you will clear it. So when we discharge people, we still advise them that they should go home and isolate themselves for another 7 days because in that 7 days, if you still turn positive a day or two later from our statistics, you would have cleared it finally, and you just practice the final 7 days of isolation in your house. The Traditional Medicine Board are working very hard. They're trying to look for two things. They're trying to look for dietary supplements that are proven to be supportive of you building your immune system. So we're looking for food items that increase your vitamin D, increase your zinc, increase vitamin C, increase your calcium, which have been established by research that if you are short of these vitamins or these minerals, that the infection will have probably a higher rate of causing illness in your body. So our Traditional Medicine Board and researchers are looking at dietary supplements, so we can advise you to eat more of greens or certain types of food that it will increase your calcium, your vitamin D, your zinc, and other things that could be possibly useful in boosting your immune system so that you can naturally overcome this infection. And then there are the herbal extracts. Now, as you recall, as scientists, we have to be able to measure the quantity of the herbal extract. And we also have to be able to be sure that we are not giving you an extract that is toxic. So as healthcare professionals, it's important that in trying to treat you, we do not cause harm. So we are very particular that the traditional medicine practitioners are able to prove to us in the Ministry of Health, and of course to you as the people of Lagos, that we're not going to expose you to something that will cause you harm in an attempt to treat your COVID. So we're looking at two things. Can you measure the quantity or the strength of that herbal extraction? Can we prescribe a dose based on that strength? And can we be sure that that herbal extract does not contain chemicals that can cause harm to your liver or your kidney or your brain or anything like that? Hydroxychloroquine, a drug called Alluvia, but the component is ritonavir. And then we're looking at convalescent plasma, which is the blood we take from people who have recovered and use that to treat patients. So the trials have officially commenced, but a clinical trial is a very difficult thing to run. So when we say it has started, we've started to receive the drugs that will be used for the trials. We've started to collect the plasma from the patients who have been discharged. We're trying to identify the centers in which we are going to roll out these trials. And we develop the ethics. In other words, we need permission from the ethical boards that we have the permission and the authority to conduct clinical trials. Now, clinical trials are very complicated, and if we're going to do it properly, we have to do it systematically. But with every week that goes by, the strategy for implementing the clinical trials is getting more and more advanced. We're also looking at several parameters in patients that are catching COVID. For example, we know that about 80% of Lagosians who catch COVID have a very mild or asymptomatic disease. And then another 10% may be moderately unwell, and then another 10% may have severe symptoms. So we're trying to understand what is the difference between those that have a mild disease and those that have a moderate disease and those that get critical disease patterns with severe breathlessness, which most of the time or much of the time can lead to death. So there are some research strategies to try and understand, using your genetics and using your environmental factors, as to why some people are protected from COVID and some catch COVID and get extremely unwell, and some of them die. We're also looking very carefully at the numbers of people that have died from COVID as research. We're trying to understand what are the common denominators amongst those people who have succumbed to COVID. And we're beginning to see a pattern. And as soon as we are able to distill that pattern in a scientific way, then we're going to publish that information so that we can get an understanding of how COVID is affecting our population. But notwithstanding, I think it is clear that something we're doing in Lagos, plus something amongst the people of Lagos, is giving us a different disease profile from what we're seeing in the Northern Hemisphere, in Europe, and in the United States, and in East Asia. So it's either that we started our biosecurity strategy early, or that there's something in the environment, or our age profile is different, or there's something in our genetics that is protecting us from the very high fatality rates that we have seen across the world. And we're hoping, and if that's any reassurance to Lagosians, the disease pattern seems to be different here in Lagos based on our data. It's not as aggressive as we've seen in the Northern Hemisphere, at least in the Lagos environment. I can't speak for the rest of Nigeria because we're still expecting the data for other states. Disadvantages of wearing the mask. There are no medical disadvantages. As long as your mask is not too thick and is stopping you from breathing, you should be okay. As long as you're not sharing masks with anybody else, you should be okay. Remember, the idea of wearing a mask is not necessarily to protect you, but is to protect the environment. So if everybody is wearing a mask, then the number of droplets in the environment will be reduced. And if the droplets are reduced, then you're less likely to breathe in infected droplets. The droplets also settle on surfaces. So if you touch a surface where some droplets have settled, then the droplets infected with the virus will be on your hands. and if you move your hand to your face, then you will infect yourself. So the whole idea is that I've told you that about 80% of people who catch COVID, many of them will not even know they have caught COVID. So they are asymptomatic. They're walking around unknown to themselves that they have COVID infection. And so if you have COVID and you don't know you have COVID and you're wearing a mask, if you cough or sneeze or just by virtue of speaking, you will produce an aerosol in front of you, then with a mask, you are certainly decreasing the amount of aerosol that is carrying the droplets that the virus is living in, and therefore the people around you will have less of a risk of breathing in those droplets that are carrying the virus. Regarding enforcement of the masks, it's been made law now, or it's been made mandatory by Mr. Governor. And so law enforcement agents have the authority to enforce the wearing of masks in public places. Now, if you're alone in your car, you're not in a public place. But if there are other people in that car with you, then you are in a public place. If you're in your house, you're not in a public place. But if your house is crowded, then we advise that you also wear a mask inside that residential area. So our advice to everybody is, in public, please put on your masks. You will be stopped from entering certain places if you are not wearing a mask. And if you are stopped by law enforcement agents, they have the authority to challenge you as to why you are not wearing a mask. I think there is nobody in Lagos that doesn't understand COVID-19 now. So the level of awareness is extremely high. Everybody knows COVID-19 or Corona or Coro or whatever you want to call it. Everybody knows about masks. Everybody knows about sanitation. The reason why some people are behaving as if they don't know is not that they don't know, but they have other priorities. So to some people, catching Corona or COVID-19 is something that they're prepared to do or to put themselves at risk because they have to go out and engage in some economic activity and earn a livelihood. And the risk of catching Corona to them is less than the risk of loss of livelihood, poverty, and malnutrition. So everybody in life has their priorities. Somebody's priority may be not to catch Corona at all. Other people's priorities may be, well, in the process of me trying to make a livelihood, I may catch Corona, but I would rather have money in my pocket and feed my children and catch Corona than to stay at home and have no money in my pocket and being unable to feed my family. So I think we have to accept that everybody in society has a different level or different levels of priority, and everybody takes a risk in trying to manage those priorities that are important to people. So knowledge base is very high. Our social public awareness campaigns have been very aggressive, but I think people make their choices. And in making their choices, you may see that there is some impression that some people don't know about Corona because of the lifestyle or the practices that they're conducting. So we are about to roll out the chloroquine trial or the hydroxychloroquine trial, and it's in two arms. We have our own trial, the Lagos State trial, which is a double-blind, which means that you don't know whether you're taking chloroquine or you're taking a tablet that's full of chalk. They look the same. Even the doctors who are giving out the medication don't know which one is chloroquine and which one is chalk. So there is no bias whatsoever in the outcome. So when we are analyzing the data, only one person in that trial group will know who got chloroquine and who didn't get chloroquine. There is the WHO Solidarity Trial as well, which we are also participating in. But it is not a double-blind trial. But we're going to participate in that as well. In one of our centers, we're going to roll out the WHO Solidarity Trial on chloroquine. And at the end of maybe in about 2 months from now or a month from now, we should start to get some information out of these trials, how our people in Lagos are responding to the use of chloroquine, either as a prevention or as a treatment. So our trials are divided into two. We're giving some drugs to some chloroquine to professionals, healthcare professionals, and to people who are in close contact with people who have COVID, to see that if we give you any of these drugs, does it prevent you from catching COVID-19? And if you do catch COVID-19 and we give you one of these clinical trial drugs, does it shorten the amount of time that you're unwell, or does it prevent you from going from mild to moderate to severe to critical to death? So if we are giving you a particular drug and compared to the group that are not getting the drug, there's a difference in the medical profile, then we can quickly conclude that this drug is actually effective in reducing the severity of the disease. So the question around COVID-19 phobia. I think this question was related to patients presenting at medical facilities, and the healthcare professionals are reluctant to see patients who are coming for other medical attention. So I think, as I said earlier on, everybody should be presumed COVID-19 positive because there are so many asymptomatic people in community. And so if you come into a hospital with very mild symptoms of COVID or even no symptoms of COVID, and you're coming for some other procedure, maybe you're pregnant or you're coming for an operation or you're coming for an extraction of your tooth or an eye examination, and you're an asymptomatic carrier, then you will transmit the virus inside the facility. So what we're doing with our personnel is, first of all, we're trying to make sure that if you're symptomatic, you will be examined before you enter the hospital, and if there is any suggestion that you have COVID-19, that we'll refer you to a COVID-19 hospital. If you don't show any signs of COVID-19, we are training our healthcare professionals to manage you as if you have COVID-19 while they're managing your other condition. So the doctors and the nurses and the healthcare professionals must be practicing a high level of infection prevention control, so that even if they're managing patients with COVID-19 who have other kinds of problems, that they're reducing the risk of that person transmitting the virus. So the patient themselves should be wearing a mask so that they reduce, whether you know their status or not, they should be wearing a mask. Now very soon, we're going to be validating the rapid tests. We've started the process. We've identified several manufacturers of rapid tests. And once we've validated the rapid tests, then it's an added opportunity for us to rapidly screen people at the point of entry into any hospital. So it will take us 10 minutes to just perform a rapid test on you. And if the test is positive, then we know we can refer you for isolation. If the test is negative, then we have a higher confidence that you can go into that facility and get the care that you're looking for outside of COVID-19 disease. We can also use that rapid test to screen our healthcare professionals and find out how many of them have experienced COVID infection before. So if the test shows that you've had COVID because you have antibodies to COVID, then the healthcare professionals will be able to practice with more confidence in their healthcare facilities, knowing that they've caught COVID before and that they are very unlikely to catch it a second time. So we're very anxious to use those rapid tests so that we can use that to screen patients going into hospitals and use that also to screen doctors and nurses, and also to screen all these returnees that are coming across our borders and through our international airports. So someone asked a question around the economic losses of COVID-19. So we've described before that a pandemic has three legs. We call it the pandemic tripod. There is the one leg is the public health crisis. The second leg is the economic crisis. And the third leg is the security crisis. Now the job of government is to find the balance so that that community is standing on three legs. So we have to manage the public health crisis in conjunction with the economic and the security crisis. The government must find a way of dealing with the public health crisis without causing an economic or a security crisis. Otherwise, we may indeed get more fatalities from loss of or breakdown of law and order, or from malnutrition, or from people dying from other conditions other than COVID-19. So it's a very delicate balance to strike, and government is doing its best. That's why you see that the government is making certain changes and policy decisions to ensure that we find that balance between the tripod of pandemic outbreak, finding a balance with the medical side, with the economic side, and the security side, so that Lagos and Lagosians are not distressed by loss of livelihood and breakdown of law and order in our attempt to manage a medical crisis. So the message of hope to Lagosians is that, contrary to what we're seeing in other countries, that most of our patients, at least 70 to 80% of our patients, catch COVID-19 and will recover naturally. As long as you're resting and you're taking a balanced diet and you keep yourself at home, you will recover. A fewer number will have a moderate disease. In other words, they will feel unwell for a week or so, but they also will recover. Then there's a much smaller number of people, say about 5 to 10%, who will struggle with COVID-19. And it is those people that we really want to know. Members of community should alert us through our numbers, our 08000 Corona. We should be custodians of each other. If you know somebody that has been unwell for a number of days and is not getting better, call us. If they have COVID, we want to know about it. If they show signs that they are very weak, they have got high fever, or they are developing a cough, and they're showing signs of difficulty of breathing, we want to see these patients, because if we start treatment in our isolation centers, there's a chance that we can rescue you from getting into a critical state. So we want to know about the patients who have moderate to severe disease, and we want to bring those to our isolation centers and manage them with our treatments to make sure that we stop them from going into respiratory failure, which is what is the #1 killer in COVID-19. And if we know about you early, we can prevent you from going into respiratory failure with the treatment strategies that we have. Many people are presenting to us late, and that is responsible for the number of deaths that we've seen in our isolation centers. If you come to us too late, Many people die on the way to the hospital, or die while we're trying to admit them, or die soon after admission, because you've gone past the point where medical intervention can save your life. So we don't want you to come to us at that late stage. We would rather know about you when you're feeling very weak, when you've got a high fever, and you're having difficulty eating, and you're beginning to have respiratory symptoms, even before you become breathless. We would like to see you so that we can manage you and treat your infection. So there were some questions around the primary health care. So I'll leave the permanent secretary of the Primary Healthcare Board to talk around the issues around the observations at the primary healthcare, and also maybe a little bit about how the doctors are coping at the primary healthcare level. And in response to my colleague from IAT, there is no reason. I'm not aware of any reason for you not to be invited or for me to appear. So at the next opportunity, I will certainly do so.
Thank you, Honorable Commissioner and members of the press. Community engagement has always been an active component. Community engagement has always been an active component of our COVID response. And then somebody asked whether we have achieved community participation yet. It is an active process, and it's something that is going to go beyond COVID. Even post-COVID, we still need to continuously get the buy-ins of our relevant stakeholders. They must take ownership. The goal is that community must own this particular process, and that is the only way we can achieve success. Now, even before the lockdown, we all know the primary care facilities are the closest facilities in the community to the people. And it was a deliberate policy that at that level, there should be no downscaling of routine services. We quite appreciate that services such as immunization, family planning, and management of common ailments in our environment are still quite important and important causes of morbidity and mortality. So we are on top of the game. Those services will go on. In fact, they are supposed to go on free of charge, so that we don't want mothers or aged people traveling long distances to access care. Having said that, we also appreciate that in an effort to ramp up testing, we've had to decentralize by co-opting additional 20 PACs to do active community case search, and at the same time active drive-in centers that members of the community can walk in and get tested. And that is why you see, from what the Honorable Commissioner presented earlier, there was increased capacity to test, and that could also have been responsible for some of the cases, increased number of cases that we are recording in our communities. But we have to get a balance. The hospitals, in as much as we are taking part in testing patients and at the same time running routine services, we must still maintain physical distancing in our facilities. Mind you, the first goal of medicine is that in as much as we want to help, cause no harm. We don't want people to come to our facility and get crowded, and that now also negates the whole objective of trying to ramp up this infection. And that is why we have started staggering appointments for certain routine services. The case in question raised by somebody of people being turned back has been investigated. And actually what happened was that mothers were given staggered appointments such that you come in at allotted time and the number of cases to be attended to in terms of vaccination will have been predetermined and communicated to those mothers. so that we don't want them to come in and you have so massive crowd commingling with other people that have come to do their test for COVID. Else, our hospital becomes a center of infection. But we must also appreciate that communication with clients is quite important, and it's an ongoing process to continuously enlighten them on what to do. And as the Honorable Commissioner also hinted you, majority of our people are already convalescing at home. So the primary health care centers are going to get more and more involved in managing a lot of our mild to asymptomatic clients as the weeks go by. There may be a need for us to judiciously utilize our resources such that the severe cases too can still have better care and better outcomes. At the same time, the asymptomatic ones also have a better chance of recovering in an home environment whereby some of their statutory responsibilities of economic activity can still go on. As I said, we need to think not only of the public health aspects, we also need to think about the economic implication and the security implication of every household that is involved in this pandemic. I think I will stop right there. Thank you.
Distinguished members of the press, there was a question about the returnees from UAE. They were kept in 2 hotels in Lagos, and the time now, the isolation time is up. The first set in one of the hotels, we've received all their results. 4 of them tested positive and have now been admitted into isolation centers. The others in that hotel will be going home today. They will report at the airport, collect their passports back, and then they will be discharged home. At the other hotel, the results will be received today. We don't have all their results yet. The people who are positive in that second hotel as well will be sent to isolation centers, and the ones that are negative will also be released, and their passports will be released home, and their passports will be released to them. Thank you.
Good afternoon, gentlemen and ladies of the press. I'm here to tell you that the secondary health facilities, they've been, during this period, the state government has decided that they should not be directly involved in the management of COVID-19, so that you can keep them to attend to other cases. So the hospitals are up and running, they are functioning to attend to all cases, both emergencies and non-emergencies. So they are working. And the state governor has mandated us to keep training and retraining our staff so that they know what to do, how to prevent on infection, prevention and control, so that you don't have cases of transmission of COVID in our hospital. And also so that the healthcare workers can protect themselves from cases of, from contacting COVID-19 infection. This has been going on, and I can tell you that the hospitals are working and they are eager. There is no issue of, initially we had issues of patients being turned back or healthcare workers not willing to attend to patients because of fear of COVID. But we have since gone past that, and the hospitals are working effectively. Thank you.
Thank you very much. Maybe we take the last section of the questions. So the last set, we'll also take it on the runway.
Good afternoon to the leadership of the Ministry of Health in Lagos and Kenny with Galaxy TV. I have a few questions.
Okay. So I have a few questions here. In your opinion, Commissioner, after this pandemic comes to a close, however long it may take, what should be the first step we as a state, Lagos, and if possible Nigeria, takes to better prepare our systems here for probably another pandemic? And then secondly, I also like to find out, can you explain briefly what Lagosians can do to help other Lagosians in the midst of this crisis? It does appear that we have left the point where people can't probably even relate with themselves anymore. So sometimes, you see that it's like even when you can give a helping hand to someone, you can't anymore because of the virus. I'd also like to find out your views about the controversial infectious diseases bill. And then finally, I'd like to find out what worries you the most about COVID-19 in Lagos. Thank you.
Sir, I also want to ask a question surrounding civil servants in Lagos. Now the group, we don't know how soon this is, but when the group resume back to work, like fully resume back to work, what is the state government, plans, and what are they putting in place to protect the civil servants when they resume back to work, and the advice they want to give those who are really gearing up to resume work after the lockdown? Thank you.
Good afternoon, sirs. Good afternoon, Mr. Commissioner. Please, I'm from TVC. I want to ask, what is the latest on the reagent production in Lagos? And I also want to ask, because it's been said that the lockdown has not really yielded as much result as we expected. An example is that of Brazil. And I want to ask, what are we doing in the place of the lockdown? What is Lagos State planning on doing? Are we planning on a total lockdown, or are we planning on extending our lockdown period? Thank you.
Good afternoon, sir. My name is Benga Salah. I write for the Guardian newspaper. My first question is, what's the number of tests that Lagos State government has conducted so far? 2, what does it cost the state government to conduct a test? 3, what does it cost the Lagos State government to treat a COVID-19 patient? 4, the state government, no doubt, have been engaging the residents. There is the argument that nutrition plays a critical role in managing COVID-19. I said the state government has been engaging the citizens in terms of precautionary measures and all that. There is also the argument that nutrition, healthy eating, play a critical role in you being able to survive COVID-19. So why are the state governments not deemed fit to engage the residents in terms of healthy eating habits and all that? Thank you.
Honorable Commissioner, sir.
Okay, the question around what will Lagos be doing post-COVID? We're going to do exactly what we did post-Ebola. which is continue to prepare for the next pandemic. The reason why you see Lagos with a large number of infrastructure and a large number of people that are trained in emergency preparedness is because we experienced Ebola. As you know, we survived Ebola, but we realized that we had certain weaknesses, and so we've been developing what we call the Lagos State Biosecurity Emergency Preparedness Plan for the past 5 years. That plan kicked in as soon as we suspected that the COVID-19 Wuhan outbreak was going to start spreading around the world, and we launched our incident command structure with Mr. Governor as the incident commander several weeks before our index case. In the last 5 years, we've performed several simulations. We've practiced what it would be like for the entry of an airborne pathogen. We've practiced what it would be like for the entry of a waterborne infection. And we have all our systems in place to react early and quickly and decisively. Now we've experienced COVID-19. We've learned a lot from this airborne infection. Ebola is not an airborne infection. It's a contact and waterborne infection. COVID-19 is droplet or airborne. As a result, it has a different dynamic. And we've learned a lot from droplet or airborne pandemic outbreaks. So, post-COVID-19, we're going to look back. We have a lot of patients. We have a lot of data. We're doing a lot of research. We've built a lot of capacity. We're going to know what we're going to do for the next outbreak. We're not going to stop. Mr. Governor has promised all members of cabinet and the people of Lagos that we will continue to develop preparedness to ensure that Lagos is not taken by surprise and that whatever happens next, and we do expect other outbreaks, that we'll be ready and we will soften the blow on the people of Lagos, just as we think we've been able to soften the blow of COVID-19. How do we help each other? I think we are at the stage now of active community spread, that we really become custodians of each other. You must know the people around you in your street, in your house block, or in your workplace. And if you see people are having problems, this issue of stigma is something that we must really get rid of. If you've had COVID, tell people you've had COVID. There's nothing wrong with it. It's not a death sentence. It's not a crime. You didn't commit any crime by catching COVID. So why are you afraid to tell people that you had COVID? COVID catches anybody. There's nobody that's resistant to COVID. And sooner or later, many people would have caught COVID, whether they know it or not. So stop hiding. Actually come out and say, I had COVID. And let people get used to the fact that you had COVID. When you catch malaria, you don't hide it. The first thing you will tell people is, I have malaria. In fact, you will say it, even if you don't have malaria, you will say, I feel like I have malaria. So it's not a crime to catch malaria. Likewise, is it not a crime to catch COVID-19? Now, if somebody around you shows that they've got fever, they're not feeling well, then go and help the person. If they can't make a phone call on their behalf. Make sure they're drinking enough fluid and that they're eating at least some balanced food. Try and get some painkillers or some fever medicine to them, but make sure that you contact our numbers. 08000 Corona. Please use those numbers. We also have our telemedicine, eco-telemed numbers. The numbers will be displayed on the screen. These are active hotlines. The moment you call that number, somebody will pay attention to you. It may be advice you want. It may be you want to report a case. It may be you want some information. It doesn't matter. Just call the number and somebody will give you relevant information around COVID-19. I'll talk about our reagent production. Since there is a shortage of reagents around the world, our scientists have become very innovative. There are 3 types of reagents we need to carry out a PCR molecular COVID-19 test, and we've been able to manufacture 2 out of the 3 locally. And so that has taken off the pressure of importing reagents that are already scarce. There's the 3rd one, which is a bit harder to make, but I'm sure that some institutions in Lagos or in Nigeria are already working on seeing how they can manufacture the 3. That is an incentive to boost our economy, our ability to be innovative and entrepreneurial, and to boost the local industrial or biomedical industrial activity in Lagos, because they say necessity is the mother of invention. We need to carry out those tests, and because we can't find them so readily, we are becoming inventors or innovative around the production of these tests. The more we test, the more we find. And when you talked about the yielding of tests compared to Brazil, well, Brazil already had a very advanced molecular testing platform in many cities around Brazil. So they were testing a lot, and as much as you test, you will find positives. Lagos is testing a lot compared to other states in Nigeria, because we also have at least more of a background of molecular testing compared to other states. So we have 4 testing sites, and by next week or the week after, we're hoping to double those sites so that we'll even have a greater capacity to test and to find people who are positive for COVID-19. The plans for the lockdown, well, I can't speak for the incident commander, and I cannot speak for cabinet at this point in time. That's a cabinet decision. But generally speaking, I can say that the government is anxious to slowly reactivate Lagos State's economy, but to do it in such a way that we are now COVID-19 conscious. So you can carry on as much business as you possibly can with a changing way in which we move around, a changing way in which we conduct business. You can see that people are doing many virtual meetings. You don't leave your house. You conduct business using digital technology. You can transact without going to the bank. You can conduct meetings, even if you have to meet. As you can see here now, people are spatially distributed. Compared to pre-COVID, the whole place will be full. Everybody will be sitting next to each other. People are more conscious of sanitary conditions. People are more conscious of ventilation. So I think moving ahead, for example, the markets, we're going to try and decentralize the markets so that the markets are not places where you go to buy something and everybody is in a very tight, densely spaced. So I think moving forward, Lagos is going to look at an urban renewal plan that will make sure that our cities and certain areas in our local governments are not areas where people congregate in very tight spots. So I think that's the future that we're looking at in Lagos. Regarding the testing, we've so far performed 16,000 tests in Lagos, which is much higher than anywhere else in Nigeria. And we are planning to continue to test up to, we're planning to test up to about 1,000 tests a day very soon. So in the next month or 2, we're going to be ramping up our capacity to test. How much does it cost to test? Well, for now, the government is providing testing free of charge. And the government pays about 40 to 50,000 naira per test. But as we ramp up our testing, we're going to have to try and use some means of subsidizing those tests, either through insurance or through some contributions from donors or from developmental partners to help us to subsidize the tests. For now, the state government is providing COVID-19 testing free of charge. And all citizens who need to be tested for COVID-19 because they are not feeling well or they've had a close contact can get that test free of charge at any of our COVID-19 testing sites in the 4 laboratories. So I think on that note, I will hand over the mic to some of my colleagues who will talk about the civil service workspace post or in COVID-19 and post-COVID-19, and some attributes around what you can do to eat a healthy diet and live a healthy lifestyle that will boost your immune system so that you can resist COVID-19, and if you do catch COVID-19, that you will have an asymptomatic or mild disease profile of corona disease. Thank you.
Good afternoon again. The question about Alausa workspace post-COVID. There's been a lot of work within the civil service in preparing for this return to work and probably a larger return to work a little later. First, now there's a wash station in front of every MDA. Then there's a dispenser for sanitizers. There's an infrared thermometer there too that's supposed to be used for everyone who's walking into the ministry, and each person is supposed to sanitize their hands coming in. Then the staff buses are also now, the arrangement for seating in the staff buses has been done so that there's no crowding in there. Arrangements have been made now for regular decontamination of the staff buses each day, morning and evening, to ensure that it's totally sanitized before the next day. Then a webinar was organized by the Public Service Office and driven by the Minister of Establishments to ensure that every member of staff in Alausa who got online for that webinar was educated on how to work safely during COVID or immediately post-COVID. So there's a lot of work going on around that, understanding that life has to return to as normal as possible post-COVID and in the safest possible way. Thank you. Okay.
Good afternoon, everybody. Concerning nutrition and boosting or supporting your immune system, there are quite a few things that we can do and we should do. The most glaring one is with your diet and how we need to increase fruits. We also need to increase vegetables in our diet. In addition to that, it is good to have some of these natural teas, the ginger, turmeric, but we're advising everything in moderation so that you don't have too many concentrated things that you're drinking. We would also say that it is important to get adequate sleep. The body repairs itself while you're resting. So 8 hours per night, good sleep. Exercise, mild to moderate. We should avoid extremes of exercise. This is not the time to prove any sort of strength, but just to get moving. Sunshine, vitamin D, has been shown to play a role in supporting the immune system. So you want to go out into the sun and spend a few minutes so that your production of vitamin C goes up. And the final one is to have a cheerful disposition. I know that this is a difficult time for everybody, but to encourage us to look for the things that bring joy. And regardless of how dark it is, we still find one or two things that make us laugh. We should actively seek them out, and those things also help the immune system. Thank you very much.
Thank you very much. Very much. Before we run off, we just want to have your main thoughts on this COVID-19. Just to have
Thank you very much. So we've come to the end of this press briefing. As usual, we're very happy to give you the state of affairs in Lagos. We don't hide anything from you. We want to give you the information as live as it comes to us so that Lagosians are fully informed of what's going on. As you can see, with our governor in charge of the response mechanism and strategy, we have the outbreak under control. We have not peaked yet, but the trend and the modeling is a very gradual one. We've only had a handful, just over 30 fatalities. This is a very small amount when you compare what's happening in other parts of the world. We have increasing number of isolation beds, and our policies are changing week by week as we watch, define, and study the outbreak landscape in Lagos State. So I think we are also learning to live with COVID, and in the next week or two, we're going to define parameters that allow us to conceptualize what it means to live in a mega city like Lagos State during and even after a COVID-19 experience. But rest assured that the government is doing all it can, and it has demonstrated that it has the capacity to predict and to limit the impact of a massive outbreak of this sort on the people and the residents of Lagos State. And we'll continue to do our best. And with your help in the press, you spread the information and the awareness. More importantly, you tell people about our Corona hotline so that the people of Lagos can reach us, and so we can reach you and help you in this outbreak. So thank you very much. Till the next time.
Thank you very much, gentlemen of the press. We appreciate you so much, and we have come to the end of today's update. Thank you so much.